Good afternoon and good morning, everyone, and welcome to today's webinar on MedFusion's new linked accounts functionality. I'm here today with Katie Steindl, who's one of our product marketing managers, not product marketing, that's me, product managers. I work with her a lot, though. And she'll be giving a demo of the linked accounts functionality as well as talking a bit about it. This is available for anybody who's on Portal 2.0, and we'll be talking about how you can let us know that you'd like it. It's free to install it in the next 3 months. So you just need to let us know, and we'll have one of our implementation folks contact you, and you can get all set up. And with that, I think I will be quiet and let Katie take over.
Thanks, Sherry. So today I'll be talking about our new functionality called Linked Accounts. We're very excited to bring this to you. We've been working on it for a while. Today, what I wanted to talk a little bit about is the benefits of the new functionality, how it works. It is completely different from our previous version, which was called Family Accounts, and I think you'll find that it is a whole lot easier and more able to really differentiate the children's account from the guardian or parent account and help with the linkage. I'll be demoing the feature and functionality through the patient portal and through the practice portal to show you how parents and guardians would manage their accounts, linked accounts, how an adult patient could manage their linked accounts, and how your staff can manage these accounts. And then I'll be talking I'll show you those guides that Sherry pointed out that will help your patients and parents set up their linked accounts. And then again, I'll reiterate how you can get this feature. So the benefits are really that this is going to make it very easy for the parents and guardians that are managing their children's health care. And it allows for parents to manage their entire family. So if they have multiple children, they want to manage their own account, their own health care, their spouse's health care, they can keep it all together in one place with one account. We also support 2 parents or even more than that to manage their children's health care with their own accounts. For example, a mother, father, a stepmother, they could all have their own accounts to manage one child or more and their information. We also have support for adult patients to manage their own health care by inviting what we call a trusted representative to have access to their health information. So, for example, an elderly parent might want his children to have the ability to view and act on his behalf. That is easy to set up. This obviously helps with legal compliance, and there's a lot of different legal legislation and rules out there, HIPAA, of course, Title 10, different state laws, and it's really something for your practice to decide on what do you consider to be the age at which a minor should be able to manage their own health care and decide if they want to share that information with their parents or guardian. So that is something that our implementation folks will help you with to set up that age. And it's a configurable age that can be changed over time if you decide to increase or decrease that age. We also help a lot with this legal compliance by offering automatic aging out. And what I mean by that is that when children at your practice turn at that certain age that you deem to be an adult in terms of their health care, we would automatically unlink the parents or guardians from those minors and then send an invitation for that minor to set up their own credentials to their account. And we'll help you through that management when we set you up. Also, we're making it very easy for your staff to manage linked accounts. I'll be showing you a little demo in Practice Portal where it's very easy to see what state the patient is in terms of being underage, minor, or an adult, who they're linked to, who their parents or guardians are, being able to manage like password resets for guardians and so forth. So that should be very easy for your staff to manage. So how does it work? It's important to know that it's all based on invitations and this configurable age out age is what I'm calling it, the age at which you determine that the ownership of a patient's portal account should be that of the patient and not the parent or guardian. So what we do is we assume that the email that is entered for an underage patient, somebody under that age out age, we assume that that email is actually the parent or guardian. So if, for example, if your age out age was 18 and the child was 10, that email that is either entered in your EMR system or practice portal, wherever your registration starts, would be assumed to be the guardian or parent. And when we send that invitation, then we send a kind of a special invitation, which we call a guardian invitation. And I'll show you an example of that in a minute. When the guardian activates this invitation or follows the invitation link, they're activating their own account, and they're also activating the underage patients, and that is automatically being linked together. So they create their own non-patient account. The guardian creates their own non-patient account, unless, of course, they're a patient at a family practice or internal medicine practice. And at that same time, the patient's account is automatically activated and automatically linked to that guardian's account. So there's two separate accounts that are automatically linked together. One is a guardian account and one is a patient account or an underage patient account. I'll walk through those steps in a second. And then another thing that we have is this age out age, and that is what is used to automatically unlink the patient from the parent. So once that patient reaches that age of age out, we have the ability for, if you want, for the portal to automatically unlink the patients from their parents at that age. It can be done earlier, and there's also a flag to skip those patients that you want to skip. So I talked about this guardian invitation. This is what goes out when we determine that the patient's age is under that configurable age, and we assume that the email is the guardian's or parent's. So this is that special guardian invite, and it says, hello, we are sending this invitation to join our secure patient portal as the parent or guardian of, and the name of the patient. Once they click on this link, they come to a page that allows them to either sign in and enter their username and password if they already have an account at your practice, or if they're already a patient with a portal account at your practice, or if they do not have an account yet, they can use option 2 here, which is to create an account. So they would enter their first name, last name, their relationship to the patient, and then click next. And that would then take them to a page where they set up their credentials, their username and password. For every subsequent child invitation that they get, once they've created this first account, they can just enter their username and password and sign in, and that'll automatically link each subsequent child that's invited. So in this way, several children can be automatically linked to the guardian. Let me move into a demo now. Okay, so here I am at the patient portal. One thing I wanted to mention or reiterate is that, again, this is all based on invitations, however they are sent, whether it's an automatic invitation that's created when you register patients in the EMR system, or a bulk invitation from Practice Portal. Therefore, if you do have create an account on at your practice, and somebody were to go through here and try to create an account for an underage patient, let me just show you what would happen. First, they would get a little error here that says accounts for patients under whatever your age is must be activated by the practice. And let's say they clicked on next here. We put up a nice message that basically says, thank you for your interest in creating a portal account. Based on the patient's age, we will need to send you an email invitation to complete the portal registration process as a guardian parent of the patient. Please contact our practice to request an invitation. So I wanted to show that because, again, this whole system works based on invitations. So now I'm going to sign in. Once a parent or guardian has activated their account and been automatically linked to an underage patient, they'll enter the portal, and if they are also a patient at your practice, for example, in a family practice or internal medicine, they would see their name shown in a bubble here. You can see that the person logged in is Maya, test patient, up here in the upper left. This is who she's looking at, herself. She has actually activated her account and been automatically linked on behalf of Tracy and Tommy, her 2 children, as well. So she could easily look at the information for Tracy by clicking on that link in the drop-down. Now she's acting on behalf and viewing information for Tracy. So anything she does here, she looks at messages, appointments, prescriptions, asking a question, forms, she is doing on behalf of Tracy at this time. She's still logged in, of course, as Maya. She can always go back to herself, or she could switch to Tommy, her other child. And now she would be acting on behalf of or viewing information for Tommy. So really, this is just listed on every page. If she were in messages, for example, she could switch to herself, and she would see messages for herself. If she switched to Tommy, she could see messages for Tommy. Another thing I wanted to point out is in this toggle, we have a little alert symbol. So if there are either unread messages or forms that need to be filled out, this little alert symbol will show here and here. Another thing that's very helpful is under Manage Family. This is the area where the account holder, Maya in this case, the mother, can see what all the linkages are for her account. So one, she's a patient, so that she's listed here. But she can also see that her dependents are Tracy and Tommy. And she can unlink them if she wants to. She can also invite a trusted representative. So in the case of Maya, she might want to invite her husband or spouse to be able to share her information. So she could enter his name here and an email address and her spouse and send that invitation. That would go to John. He could then receive that invitation and sign up for a portal account the same way she did, and he would be automatically linked to Maya. That is really the capability for an adult patient to invite a caregiver or somebody that they want to share their health information or allow that person to assist in managing their health care. Okay, I think that is what I wanted to show in the patient portal. I'm going to move over to the practice portal now to show you how this looks for these different patients. So on the patient dashboard, I'm right now showing Tommy, one of the children that we just talked about. And we do something a little different in Practice Portal to show that this patient is underage. We have a little icon here to show that they are a dependent that's linked to a guardian or parent. And you can see that, of course, their age is just less than 1 year old. And if I were to scroll down here, I would come to a place that says Family Management. This shows who the parent and guardians are. So in this example, Maya, who I was just showing you, is the mother, and she is linked to Tommy. She is the parent guardian of Tommy. I could manage things like sending her a password reset here. I could unlink her account. I could also click on View and be taken to her patient dashboard. And in this case, she's a patient again. If she weren't a patient, obviously there would not be a dashboard for her. But this is Maya's dashboard. And you can see that she is, of course, an adult. There's no special icon. And if I scroll down to the family management area, you can see that she has 2 linked accounts. She has Tracy, her daughter, and Tommy, her son. At this point, you could, as the staff member, manually age the patients out if desired, and that would unlink the patient from the Guardian. I'm going to actually go back and view Tracy's dashboard now. So that's showing the patient dashboard perspective. You can also choose to invite a new guardian or parent. So you might want to have the father be linked as well and have his own account. I would just click Invite New, and that would allow me to enter the first name and last name for the father, their email. You can select a relationship, click Invite. And that sends another guardian invite out to the father. Once I do that, you can see that information about the guardian invite here. I could resend it, I could follow the link for the invitation, etc. Until he's activated. Once he's activated, he'll be shown down here, and he'll be automatically linked to that child. You can also invite more than 2 guardian or parent invites or invitations. Now I'm going to move over to this area here called Family Management. It's a tab over on the far right of the practice portal. And this is really a reporting area that shows who your dependent patients are and what patients have been aged out. If you were to search on dates of birth before a certain time period, I'll just do all of them at this point. You can see that this lists all of the dependent children, their ages, their names, their emails, that they're a dependent, how many guardians or parents they have, when was the last invitation sent out, and we have a flag here for anybody you'd want to mark as lacking medical decision-making capacity so that they won't be automatically aged out if you were to use the automatic age-out process. You can also manually age somebody out. So, for example, let's see here. I'm going to age out Tracy, who is, no, let me go do Jenny here. She is a 14-year-old patient who has 1 guardian. And you decide to age her out. I'm going to click that link. Okay, to unlink this from the guardians, yes. Okay, and then you see that Jenny no longer is on this list. But if I were to search for her under the aged out, you can see that now she's been aged out. What happens to her email when she's been aged out is that it gets changed to agedout@medfusion.com, because we don't want to assume that the email we have on file is hers. Obviously, it was originally the parent or guardian. So we clear that email, we change it to agedout@medfusion.com, and we put it in red to signify that she doesn't have, there's no way to access her account at this point. She doesn't have a guardian. She doesn't have credentials to access her own account yet until you add a valid email, which can be done right here. So I'll just do that here. Okay, so once she has an updated email address, let me just then you can send out a what we call post-age-out invitation. And this invitation will allow Jenny now to create her own credentials to access all the account information that she had up until the point where she creates her credentials.
So all her information stays in the system, and then she can access it as soon as she has created her own account?
Yeah, so for example, if, let's say at the age of 14, she was aged out, and maybe she leaves the practice, or she's not seen again until she's 17. At the age of 17, you could go in here and invite her to create her own credentials. All of the health information that hadn't been sent or that was on file before for her would still be accessible by Jenny. And of course, at that point, Jenny could invite her parents to be trusted representatives if she chose to, for billing purposes, for just accessing her information. If she chooses to invite them, she can. All right, that's the end of the demo portion. So Sherry talked a little bit about some helpful guides for parents and patients. These, of course, are on the webinar, and she'll be sending those links to those, right?
They're in the handouts. So if you guys wanted to download them right now, you can go to the little handouts section of your control bar and download them. But I'll also send a link to the Health Center where they can be found as well.
Yeah. So the one on the left here is showing the guide for parents and guardians to create accounts to then be automatically linked to their children, and it walks through the easy steps to do that and the choice of whether to enter their username and password because they already have an account or to create one. And the one on the right is for trusted representatives. So when a trusted representative receives an invite, or how to send those, how to send a trusted representative invitation as an adult patient. And those, of course, are in English and Spanish. So how do I get linked accounts? After the webinar, you'll be receiving an email, and there'll be a form to fill out in that email. And it's as simple as entering that information. Once we receive it, we will be contacting you. An implementation person will contact you. It's free, and we are waiving a 1-hour implementation fee through August 10th. So please sign up, and we will be happy to set you up. That implementation staff member will call you. There's a little bit of a few steps we want to walk through with you. One is to configure that age-out age. So be thinking about what you, at your practice, determine to be a good age where you would determine that people are minors in terms of their health care under that age and are treated as adults above that age. And then we will just walk you through some simple staff training. We have some materials for your staff as well to be able to manage these accounts through Practice Portal. And we'll also be talking to you about automatic age out and whether you want to turn that on for your practice or if you want to manually age out, or if you just don't want to age out at all, that's fine as well.
We have a couple questions.
Yeah.
We have one question. Once we activate the age-out age, will all parents be locked out based on the age-out age and receive an email invitation automatically?
Yeah,
So I think
ask that again.
Yeah, no, I know. Once we activate the age-out age, so once they're implemented and they activate the age-out age, will all parents be locked out if the children, I assume, are older than the age-out age and receive an email invitation automatically? So
what will happen if a patient is greater than that age-out age? So, for example, let's say you use 16 for your age-out age and a patient is 18. We're, at that point, going to assume that that email is the patient. So it will be written for the patient to activate. At that point, the parents aren't locked out, but it's up to that patient, that child, or that 18-year-old to decide whether they want to invite their parents as trusted representatives. So it's important that the parents and guardians aren't activating the account for patients who you determine to be an adult. 18 is a good place to start. You can change this age-out age if you need to. If you try it out and it's not working for you, there's no problem with changing it. Anybody who's been activated or been sent an invitation prior to changing the age-out age, it'll still assume that same age as when it was sent out. But anybody subsequent to that time, it'll be treated as the new age-out age.
Right. How can I view from the portal family management? So I think the tab, does that appear when they are implemented, or is that already there?
In the Practice Portal?
Yeah.
Yeah. So that will be, once you have linked accounts turned on, that tab will appear. And it's actually, at this point, we don't have any permissions around it, so all of your staff people will be able to access that, but that will appear, and you don't have to do anything to get that to appear, to look at who are the dependents, who's been aged out, etc.
How does this work when a practice has an EHR integration, GE or Greenway or something? Is this all done through the practice portal?
Yeah, it's absolutely all just in the portal. The way it works is that you would do everything like you normally do. If a patient is under that age, you enter the parent-guardian's email for the patient. And I'm assuming that's what you do today as well. If a child is underage, you enter the parent or guardian's email. You tell the parent-guardian they're going to be receiving an invitation. Once that demographics information comes to our portal, after you click register in the EMR system, the portal then decides whether the patient is underage or above age. And it knows automatically what type of invitation to send out. If the age is under the age out age, it'll send a regular patient invitation if the age is over the age out age.
Can we add exceptions to the age out age? Say there is a special needs young adult, for example, and they want to remain linked.
Yep. Yes, we can handle that. So in the practice portal, both on the patient dashboard and that family management area, you can actually check a setting for the patient to indicate that they lack medical decision capability. And if they're marked, they will not be aged out. They can be manually aged out, of course, by unchecking that. But when the automatic age out runs every day, it will skip over somebody that has that flag. And I actually should talk a little bit about the automatic age out. We are going to be running a daily job to automatically unlink patients from their parents that reach that age. So the day that they reach that age out age, they will be automatically unlinked from the parent, unless, of course, that flag is checked.
Right. This practice doesn't see patients below 18 years of age. Do we need to implement this to allow our elderly patients to be able to select trusted representatives?
You, of course, don't have to. It's a convenience, though, and we know that as the population is aging, and even for spouses, that it is a nice feature to allow patients to be able to invite trusted representatives. We've gotten a lot of feedback from people so far that they really appreciate being able to invite a caregiver or their spouse to be able to view the health information and act on their behalf. Definitely an elderly parent may want to invite their children to have access to their account or their information. So it's really a nice feature. And of course, the practice staff can manage the same, password resets and things like that for that trusted representative through Practice Portal. A mother, a stepfather, and a father who all want their own emails and own accounts, they can have their own accounts and emails and all be linked to that one child. And any messages are sent to all of 3 guardians. So for example, if the mother were to send an ask a question message to the practice or provider and the provider responds, a notification email will go to each 3 email addresses for each 3 of the guardians. They would log in and they would all see that secure message with the response. Or if one made an appointment request, they're all going to see the confirmation that the appointment request was made, and they're all going to see the response to it. In that way, we manage multiple emails because there's an email associated with each account.
One last question. We have quite a few adult patients who have caregivers. Once we update our system, will patients be able to log into their account and send caregiver email invites, or do we need to invite?
The answer is yes, that once you upgrade to this new linked account, your existing adult patients or elderly patients will, under my account, be able to click on that invite new and invite a trusted representative or multiple trusted representatives. So that is something that, and actually currently we don't have functionality in Practice Portal for the practice to invite a trusted representative, something we're hoping to add in the future. But at this point, yes, the adult patients would be able to do that.
So if you have emails for the caregivers, you might want to send them an email that says, we have this new functionality, help your mom, dad, set this up if they have, any issues with using the portal. All right. Well, that's all the questions that we had. And Katie, thank you.
You're welcome.
I hope this is as exciting for all of you as it is for us. We were so thrilled to get a whole new workflow and new design for this that we're pretty proud of. So we hope it is very helpful to you and your patients. And I'll be sending an email probably tomorrow afternoon with the little form. And it's easy. You just click on it and just provide a little bit of contact information. We just want to make sure we have the correct contact information. And one of our implementation folks will give you a call and set up time to get you all set. All right. Well, thank you, everybody. Have a great rest of your day. And Katie, thank you.
Thank you.
Bye-bye.